How has COVID-19 changed your nursing practice or setting?
It's very disconcerting to note that nurses, highly trained and knowledgeable in infection control and prevention practices, have been put into a position where they're forced to select and implement protocols based on the availability of supplies and resources and not evidence based practice. COVID-19 has really highlighted the severity of the situation for long term care homes across the province. We are seeing different things being implemented, and we are taking extreme protective measures in order to protect staff and residents. But I know the resource situation is affecting all healthcare sectors.
Tell us about your lived experience working during COVID-19.
Being a nurse and working in long-term care has its own unique and intense demands. In the course of our workday, we plan, implement, and oversee the delivery of resident care, respond to any medical events, interact and offer social supports, education, and resources to family and unregulated healthcare workers. And we also liaison between specialists such as registered dietitians, physicians, pharmacists, physiotherapists, spiritual and pastoral care, and so many other valuable social and health professional services. This is in addition to administering safe medication practices. COVID-19 has really heightened and intensified these challenges on so many levels. Despite the increased pressures and anxieties nurses and other team members in long-term care are experiencing, I'm seeing such extraordinary efforts being made to support, protect, and care for residents with the resources that are available. The population being cared for in long-term care homes, they're often living with multiple and complex functional and/or cognitive health conditions. And because of this current situation, they're now missing their families. They're worried about their loved ones. And this is in addition to trying to understand the current situation, trying to understand why they're being approached by people in mass all the time, why the routines that they've previously depended on have changed so much. While this is difficult for many individuals across the health continuum, residents in long-term care have health conditions such as dementia, hearing loss, speech impairment, and this really does add to the complexity of the situation. I do see staff really stepping up to help ease those anxieties and offer comfort care to the residents as they wait for this pandemic to reach an end.
What is your best advice or key messages for nurses working in long-term care?
My best advice would be know that you're really making a positive difference for the residents, families, fellow staff, and even communities as a whole. The long-term care sector is filled with dedicated, compassionate, and hardworking nurses who have demonstrated outstanding leadership, assessment, and clinical skills. Nurses are experiencing increased pressures and challenges during these unprecedented times. So it's important to continue to support one another and to take a moment to really reflect on the positive difference you are making in the lives of others.